It's that time of year to get the flu and your booster shots, but for a variety of reasons, it's been a lot tougher this go around.
Dr. Kohli joins us now, and okay, so it's one thing to give advice to go get a vaccine, but actually making it happen things have really changed since we were in the height of the pandemic.
It's been ridiculous, actually, and to me as a medical doctor, I am so frustrated because I'm telling all my patients to go get those vaccines, but there are so many levels of barriers at every step of the way now that we're out of this public health emergency where no one is taking ownership of this. No one is actually held accountable for all the problems that exist, and so really the problem is no one's getting the vaccines.
What are some of the problems?
Every step of the way, we have a problem. So manufacturer, so Pfizer and Moderna are both saying that they're keeping up with the manufacturer, but if you actually look, I mean, the pharmacies are not getting the number of supplies that they need. So that's step number one. Step number two, the insurance companies, they haven't updated their billing codes yet. So they're actually saying, oh, well, when we get around to it, which by the way, could be a month or 2 months or 3 months, when the peak of COVID will already starting to occur, then we'll cover the reimbursements. Third step is the retail pharmacies. They have staffing shortages, so we don't have enough pharmacists to administer these, supply issues as we talked about. And oftentimes if you walk in there and you don't have insurance or your insurance doesn't cover it, they'll say, well, pay $200 almost, and then you can get this vaccine.
Yeah, that's absurd. And we just had some research come out that like 30% of people say they're not even interested in getting these shots, which feels like a problem. Are we not doing enough to push it? But if you want the shot and you do have insurance, you don't have insurance, like what are your methods that you can go about?
In theory, and here's the problem, Alex, is that when the vaccines were so readily available, we still had so few people taking them. And now with all these barriers that we put up, even highly motivated people are unable to get it, much less the ones that are uninsured, lack literacy, or lack access. And so the government technically has a program, it's called the Bridge Access Program, which is supposed to provide cost-free vaccines to the uninsured or the underinsured. So if your insurance doesn't provide you the vaccine that you need. But when you actually try to go and make that happen, many of my patients have told me that they're not prioritizing those patients because of cost issues. So here we see an example of dollar signs getting in the way of public health. And it's really a shame because I thought we had learned a real lesson from what we lived through over the last 3 years, knowing that these vaccines kind of gave us our life back. And now, thanks to all the people who want to cut in the middle, our patients are not able to get them.
What about when you went to go get your vaccine? I know you had quite the experience.
Yes, and this is one of the reasons I'm so heated about this is because I have not been able, as a physician who's been exposed to COVID on a regular basis working in the hospital, been able to get my COVID shot.
Are you serious?
Yes. I've tried 3 times and I've been turned away from 3 different pharmacies unless I pay that $190 price tag. And so here's the dilemma. I have Kaiser insurance, and Kaiser is only providing the Pfizer vaccines because they got those at a lower cost. And I had an allergic reaction to the Pfizer vaccine. And so for someone like me, it's not that I shouldn't get a vaccine, it's that I should get a vaccine I'm not allergic to, which would be the Moderna. But they're refusing to cover the cost of it or to reimburse me if I paid out of pocket for it. And you know, Walgreens and CVS are marking them up so much. They get them for $100 and they're charging patients $190. So it's just everybody's greed here that I feel like is getting in the way of our public health. And my worry is that, you know, the storm is looming on the horizon. We know how to avert it, but with this kind of, you know, lack in motivation, lack in regulation, it's unfortunately going to be a tough winter season.
Okay, we only have a few seconds left, but I mean, what is your advice? Like, people are watching, like, I need to get my shot. What do I do?
I would say call your public health department because they have resources and they can register complaints against specific pharmacies. So if you've had an experience like this where they refuse to give you a shot or they're charging you $190, make your public health department aware because then they might hold those pharmacies accountable because they are getting these supplies from the government and they really are required to provide it to anyone regardless of insurance.
Wow. Goodness. Dr. Kohli, thank you.